Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with the Montgomery County Latino Health Initiative? Find out more right now. My guest this evening is David Del Pozo, Program Director of the Latino Health Initiative. David, welcome to Housecall.
Thanks so much for having me.
Briefly tell our viewers about your professional background and how you came to be Program Director of this important program.
Sure. So again, my name is David Del Pozo. Originally from New York. My parents are from Ecuador in South America. Most of my professional career I've spent in the not-for-profit or human services sector, working with underserved communities and populations. I've been with Montgomery County government for the past 4 years now at the Latino Health Initiative as a program manager, and working mostly in community programs, and most recently spending a lot of time and effort on our COVID response work.
Terrific. So briefly tell our viewers about the specific mission of the Latino Health Initiative.
Sure. Our mission is to improve the quality of life of Latinos living in Montgomery County by contributing to the development and implementation of an integrated, coordinated, culturally and linguistically competent health wellness system that supports, values, and respects Latino families and communities. So in plain English, we help to address health disparities impacting Latinos here in the county through different either direct interventions or through other advocacy efforts.
And what are some of the typical healthcare disparities that you see among individuals in Montgomery County?
In general, there's a lot of incidents in the Latino community as it relates to heart disease and diabetes. These things are sort of related, obviously, to socioeconomic status of many of our Latino community members here in the county. We know that despite the county being a very affluent and well-off place, there are still very many families that are struggling economically speaking, and that's before the pandemic even hit. So a lot of our work is meant to address the disparities that are often associated with families and communities that are economically disadvantaged.
You mentioned the economic disadvantage situation. Have you found that nutrition as a result is an issue as well?
It certainly is an issue when you are living on a very limited budget. And so just to give you an example, previous to the pandemic, one of the programs that we did at the Latino Health Initiative was a healthy eating workshop. So we would work with community groups through schools or in partnership with the library or different senior centers to deliver healthy eating workshops to participants so they could learn more about, the sort of the basics about eating better. Once the pandemic started and everything switched to virtual, we were looking to deliver that workshop virtually, but we had to pause because we realized also that at that time, there was a lot of food insecurity issues. And to go to try to engage a community or a group of community members to talk to them about eating better and eating healthy could fall on deaf ears if you have been economically impacted to the point where you don't have that luxury of being able to buy the healthiest of food ingredients for your household, and you're just trying to make kind of ends meet as best you can. Lots of different folks within the county were also accessing food through different food distribution, either at churches or some of the service consolidation hubs that popped up as a result of the pandemic fallout. And those are situations where many times you line up because you have that need to get a box of food, and then you have just what's in there. You don't get to go shopping for that. You just get what you get, and so you need to make that last and feed your family, and so you're not able to make those decisions about what's maybe the most nutritious thing I could serve my family tonight. It's just sort of what you have at your disposal.
You mentioned several times the pandemic. What are some of the challenges that you have found are more common and specific to the Latino community?
One of there's a lot of things that have intersected here over the course of the past year in these times of COVID. Initially, many of us received the stay-at-home orders: don't leave your house, stay at home, only go out to the supermarket when you have to. That was a privilege that many of the folks here in the county who did not have those kinds of work situations could afford, and who had to continue to go into work because they were frontline workers, because they worked in service sector, restaurants, other types of line of work where if you don't show up, then you don't get paid, and there is no necessarily a job the next day waiting for you. You show up today, and then hopefully you get invited back tomorrow, and you go from there. So that economic impact very much dovetailed with the health impact over the course of the last year, and that was something that disproportionately impacted Latinos. As we know, many Latinos make up those service sectors of the economy here in the county.
We have done similar programs as we are this evening with representatives of the Asian American Health Initiative and the African American Health Initiative. But one thing I think that unfortunately is unique about the Latino Health Initiative is the fear that it was created during the Trump years for immigrants to our country. Do you find that fear has adversely affected your ability to connect with residents, to reach them about these important healthcare issues?
That's a real understatement. The fact that over the course of the last number of years, there was an active hostility from the federal government mostly, but the way that that's received at the individual level is that it's the government. And so you may have a very kind and welcoming government here, like we do in Montgomery County, like I'd like to think that we represent. Certainly that's one of the mantras of the county, to be welcoming and no wrong doors in terms of access to service. But when you hear on TV or on the radio the vitriol that was being spewed over the course of the last number of years, and then you fast forward you're in a pandemic, and in our role in the Department of Health and Human Services, we're trying to communicate to the public, wear your mask, practice social distancing. If you need economic assistance, call this number. If you need to get a test for COVID-19 or a vaccine, come to this location. You're going to really think twice about that after you've been spending years listening to someone say, if you access services, we will put you on a list and we'll round you up and we'll raid your home and expel you from the country and separate you from your family and your kids. So I'm sure that is an awful way to sort of lead your life, but that is probably a common experience amongst not just Latinos. There's a lot of folks from all over the world here in the county, but in terms of the community that I'm most familiar with, the Latino population here in the county, that is a common experience that you have to live in every single day of your life.
Frightening, just terrible. I understand that the Latino Health Initiative, in turn, has a new project called Por Nuestra Salud y Bienestar, which I believe stands for Our Health and Well-Being. So what is that all about?
So if you go back to about a year ago, the pandemic was really picking up steam. There were a lot of efforts that were underway within the county to help meet the needs of the community at large in terms of testing, in terms of economic assistance after the economic impact that was being felt from all the job losses. But we started to see that that message and those services and resources weren't necessarily reaching the folk that needed it the most. And in the case, again, of the community that I'm most familiar with, the Latino community. So, one of the Latino Health Initiative is works in tandem very closely with a group called the Latino Health Steering Committee. It's made up of leaders from local organizations, mostly health, but in other sectors as well. And through a lot of advocacy efforts and bringing to attention the disparities impacting Latino communities, we are able to get funding for the Por Nuestra Salud y Bienestar project for our health and well-being. And this is a culturally competent and linguistically appropriate COVID-19 information, services, and care program for the Latino residents of Montgomery County.
How has it worked out?
I think that it has been an amazing success. So again, after about a year ago, those discussions were taking place. The program was brought together rather quickly. And by the first days of August, proposal had been submitted and funding was, obviously the process of ratifying that and getting that approved was underway. But by the end of August, we had already started bringing COVID testing to communities across the county targeting Latinos. That was just one component of the project. The project is made up of many other features, including community outreach and engagement, clinical follow-up, case management services, and its own communications arm to, again, deliver critical information and health messages to Latinos in Spanish.
Circling back to what we discussed earlier about the unfortunate fear members of the community have with the government, did you find that when you had the outreach for testing and then subsequently outreach for vaccination, that there was resistance? People were afraid if they showed up at the clinic, they would get arrested?
There was certainly a resistance, I would say, in general. I wouldn't say that it was specifically on that issue. That issue, I think, looms very large. And so maybe that wasn't always articulated. But not having health insurance is also something that played a significant role in folks being unsure. Just generally not being habituated to accessing health services. If you haven't seen the doctor in years, and now you have a cough, again back to like September or so, you have a cough or you think you might be sick, you might ask a friend, what should I do? Where should I go? Maybe they know, maybe they don't. Maybe they are able to tell you, or maybe you hear about a resource and then you start to wonder, well, should I go? And so one of the strategies that we deployed to really kind of cut through that hesitance was partnering with a lot of different community organizations who had those relationships of trust already established, so that we could piggyback off of those relationships and connect with the Latino community. One example of which is the work that we've done with faith-based organizations. We've partnered with so many different churches. In general, Latinos there are lots of Latinos who are very observant and Catholic and religious and practicing. They practice different their faith, and it's part of culturally, it's part of who they are. And so partnering with pastors at different churches, not just to deliver messages, but also to bring testing and ultimately vaccination efforts directly to those sites where there would be a reduced barrier to access. So it'd be one thing to say, okay, I'm showing up at a church to tell the congregation about, come to our event over at the Civic Center. We did some of that, but we also said, well, let's just bring the testing and the vaccines here. The families are already here. This is a place of trust. They have confidence and feel free to come and practice, observe their religious practices and be with their friends in the community let's cut out a step, let's bring these services here. And I think that was a really effective approach that we undertook.
Well, we're going to pause briefly for a public service announcement. More with David Del Pozo, Program Director of the Montgomery County Latino Health Initiative. We'll be right back.
When times get dark, we can't see the help that's all around us. Let 211 be your guiding light for healthcare and other resources. Call 211 or visit 211.org.
We're back. My guest this evening is David Del Pozo, Program Manager for the Montgomery County Latino Health Initiative. David, you had mentioned partnerships that have worked well for the Latino Health Initiative. Briefly, besides dealing with members of the clergy and local churches, what other partnerships have worked well for the initiative in Montgomery County?
Sure. So again, just being guided by meeting the community where they are and going to them, we have developed partnerships with local shopping centers, recreation centers. We've worked closely with a couple of the different city jurisdictions here within the county. So like City of Tacoma Park, City of Rockville, City of Gaithersburg. We've also worked closely with a number of residential complexes. So going specifically into condominiums and different housing setups to deliver services directly to them, in addition to working with some early education center and others that I'm sure I'm forgetting. But lots of different partnerships that really has accelerated and allow us to scale these efforts so that we could, again, meet people where they are, in places where they have already have regular routine foot traffic going to, and that they trust and feel comfortable engaging with us there.
Do you have any active interface to your program with representatives at the state level and or federal level?
Most recently, we have been working to support a number of the different FEMA vaccination sites. So again, it's such a great resource, especially, if you look back a few months, there was a scarcity of vaccines. And so ultimately we were able to get over that hurdle. But then the issue became, well, how do we distribute this to folks? So how does that get done? And so FEMA was able to obviously come in and bring a lot of those resources to bear within the county, but they are not of the county. And so we've partnered with them to help them in terms of getting the word out, as well as providing on-site technical support in instances where they may not have enough Spanish-speaking personnel on hand to be able to, again, deliver these services and have those discussions with people as they're coming in to get their vaccine doses.
Maryland, compared to most states, has done quite well with its percentage of citizens vaccinated. And in particular, Montgomery County has done very well. By now, I'm sure 70+% have been vaccinated. What is your sense of the Latino community in the county? What percentage?
In terms of a percentage, and I know that the county is doing very well, and not just even at the state level, but across the country. I know that, again, initially we talked a little bit about disparities impacting Latinos earlier, and that did lead initially to sort of a lack of access. But ultimately, as time has gone on and we've seen some of the data come in, the Latino community and their accessing of the vaccines has really caught up, and I think at this point has even outpaced the white community within the county, which is no small feat. I'd like to think that we're a part of that, not the only reason why. Certainly a lot of hard work is being done to get everyone a vaccine who's willing and able. But that is something that is a source of pride for us at the Latino Health Initiative, that we've been able to kind of overcome some of those barriers to access that we knew would present themselves and that we saw presenting themselves initially, and to see it now to a place where folks are coming out, the numbers are going up, and we still have it, a bit of a way to go, but we're getting there. And our mission, again, within the Por Nuestra Salud y Bienestar project, is to, continue to bring those services, primarily the vaccine, but other wraparound services to Latinos who still may be holding out or for whatever reason have not been able to come across us.
By breaking down these barriers you refer to, do you think that a positive spinoff will be a long-term relationship with members of the community, that they'll be more open to other healthcare outreach programs?
I really hope so. And I really, I'm definitely motivated, not just me personally, but I know that with my colleagues, it would be a shame if, let's say, a month from now, everybody was vaccinated, job well done, we can, put our tents down and go home. It would be a real shame if we were just to get to that point and then leave all those relationships that have been built and developed with partner organizations, with housing complexes, with church groups, to leave those to kind of just wither away. I think that this is a sort of a 2.0 or a resetting of the relationship that county government can have with the community, with the entire community, and in this case, the Latino community.
For patients that need a primary care physician and they don't have health insurance, do you try to enter them into some sort of social program or a free healthcare clinic? I mean, what do you do? Let's say somebody's diabetic, they clearly need long-term management. So what are your options to plug them in for long-term medical care instead of episodic health care?
So part of our project with Por Nuestra Salud y Bienestar has been the clinical piece, obviously, testing initially and now vaccines. And we've done that work in close partnership and coordination with 4 clinical partners, Care for Your Health, Mary Center, Proyecto Salud, and the Caseman Clinic. And so we're out there, they're in the field every day. We're oftentimes right there along with them. And we are able to engage the public with regards to the vaccines and testing in some cases. But those interactions are sort of the entryway for folks to have a more permanent relationship with a healthcare provider, so that they can, the next time something comes up, be more comfortable with accessing health services. Again, lots of members of the Latino community are undocumented, so those types of resources are really crucial. We also do have, obviously, Montgomery Cares and Care for Kids clinics for eligible residents.
So are there any messages that you would like to share with the community in terms of how can people help and things like that?
Obviously, one of the first messages, and I think that the county executive was saying this on his call earlier today, is this is not over by a long shot. The variant is starting to pick up steam out there, and we have to remain ever vigilant. That means continue to practice those basics of social distancing and washing your hands and wearing a mask and just getting accessing testing and getting certainly a vaccine, scheduling yourself to get a vaccine so that you can take care of yourself, your family, and ultimately of your community. The other thing I would just add to that is that lots of times, a common view is that in trying to reach underserved communities, we're sort of having to on a system level, we're trying to make up for sort of deficiencies that they may have, that they don't speak the language, they don't have access to transportation. I would just like to remind folks that there is a lot of strength and resilience within the Latino community and other, obviously, communities to be able to, despite not being really thoroughly integrated into the health system or just systems in general, without the benefit of being able to really have services delivered to you in your language, still being able to be a part of our community, send your kids to school, help them with their homework, go to work, help to staff, businesses and restaurants and all sorts of different services that we take advantage of. There's a lot of assets that our community has that should not be forgotten.
Well, if our viewers have any questions or want to learn more about your different programs, how can they reach you, David?
Our website is a great place to get more information about our activities and events, ongoing efforts that we're engaging in. I'll also remind viewers that we are very active through social media, through our Facebook page to promote, again, everything that has to do with staying safe, accessing services within the county that are helping residents with food insecurity, economic impact, rental assistance, and certainly resources on where you can get a vaccine, where you can get a test, and other things that you could do to continue to overcome these difficult times.
Well, David, thank you for joining us on Housecall.
Thanks so much for having me. This is a lot of fun.
My thanks to David Del Pozo, Program Manager of the Montgomery County Latino Health Initiative. My thanks to my staff at the studio. My team is just terrific in putting this program together. And my thanks to you, the viewer, for welcoming us into your home. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it'll be Dr. Robert Sanker, a noted dentist specializing in prosthodontics in Montgomery County. And he'll be providing a practical overview of all the exciting new developments in dentistry right here in Montgomery County. It's going to be an interesting show. See you then next time for another edition of Housecall. Good evening.